Hello everyone. Today I will be talking about the first aid for sprains and strains in children. Sprains and strains are very common when they fall down and twist their ankle, or they fall on their hand or hurt their elbow or the shoulder. These injuries keep happening in children. The management of a sprain is very simple and can be done at home for most cases. Very few cases you need to go to the hospital if it is severe. So the first aid principle for any sprain is RICE. It is a short form for rest, ice application, compression and elevation. So rest, obviously once the child is injured, you try to give that part as much rest as possible. Of course, in children it may not always be possible because they will not stay quiet for a long time. But when they are sleeping, or at least when they are having food, make sure that they sit as much as possible and don't run around too much. The second thing is ice application. Take ice, wrap it in a cloth and apply it over the injured part for around 15 minutes or 20 minutes. You have to reapply every 4 to 6 hours if required, and you do this for the first 2 days or 48 hours. After that, ice application does not have much of a role. After applying the ice, you have to give compression. Compression can be given by any crepe bandage. In fact, I would recommend to keep a crepe bandage at home as part of your first aid kit, especially with children around. You get it easily in the pharmacy, no problem in that. So you compress that area. Don't make it too tight. You should be at least able to pass your finger through the crepe bandage and not with great difficulty. If it is too tight, then it can cause a problem. After you have applied the crepe bandage, you give elevation. For elevation, when the child is resting, the child is sleeping, use any pillow or cushions and place it under that affected part. So if the foot is injured, just place a cushion or a pillow under the foot to keep it elevated. If the hand is injured, then you place it under the hand when the child is at rest. Most of these sprains will start showing improvement within 2 days. You can also give some mild painkillers if required. So if it's paining initially, you can use paracetamol every 6 to 8 hours for the first 2 days. If the pain is a little more, even ibuprofen can be used, no problem. So for the first 48 hours, you can use painkillers if required. But if even after 48 hours you feel there is no significant improvement, then please visit an orthopedician. In case the injury is very severe, you hear a snap, like a bone fracturing, you can sometimes hear a snap. The swelling is increasing rapidly and there is significant swelling, not like a common sprain which most of us have seen. The pain is too much. The child is just not able to put the foot down, not able to bear weight at all, not able to keep the hand down or the elbow down. Then please rush to the emergency. If you notice any deforming of the injured part, like many times children fall on the forearm and you can see like a bend or a slight deformity in the way the arm is looking or the forearm is looking. If there is any obvious bleeding or any, you can see the superficial skin has been ruptured, then probably the bone is protruding out. In all these cases, please rush to the emergency immediately, or later on also if you find that you initially feel it's just a sprain but the swelling is again increasing rapidly, there is discoloration of that part, like it is becoming bluish, blackish, then you have to visit the hospital. Hope this helps in case of sprains in your children.